When a patient is in my clinic and we arrive at a diagnosis of dermatomyositis, I think one of the most important issues to address is the association with underlying malignancy. It is well accepted that there are a certain percentage of patients with dermatomyositis who have developed that condition because of an immune response to an underlying malignancy. And I like to address it with patients because I think they are going to find this out on their own if we do not address it by looking on the internet. And it can cause a lot of anxiety and fear, understandably. And I like to explain it to patients because I think there is data that can help ease some of that anxiety. For example, although we know there are a certain percentage of patients with dermatomyositis who develop it because of an underlying malignancy, the reality is that percentage is somewhere between about 15% and 25%. So the reality is the vast majority of patients with dermatomyositis will not have an underlying malignancy. Additionally, there has been abundant research over the past several decades that has uncovered some risk factors for potentially finding an underlying malignancy in patients. And some of those include certain myositis associated or specific autoantibodies, most importantly, TIF1 gamma autoantibodies, the patient's age over 45 years old, certain characteristics of dermatomyositis disease, like severe disease that tends to be refractory to treatments, cutaneous erosion or ulceration. So there are other things that we can look for and comment about to patients to help them understand what the next steps will be. Also, the other thing we know is that there is an association in terms of when we expect to find a cancer in relation to when the patient develops dermatomyositis. Typically, when we think about cancer-associated dermatomyositis, we think about it as being defined as a cancer that is diagnosed within 3 years of onset of dermatomyositis. And we also know that far and away, the highest risk period for actually diagnosing an underlying malignancy is the 12 months following a diagnosis of dermatomyositis. So when I see patients who come to me from out of town or out of state who have had dermatomyositis for 5 years and they're just looking for better control, then I still have a conversation about underlying cancer, but let them know that just by the sheer fact of how long they've had the disease, their risk of underlying cancer is extremely low and really doesn't warrant any extensive screening tests to be done by that point.